All right, so I just had this interesting eval. So I had a 13-year-old come in. He was a baseball player, right? So the guy went to a sports orthopedic doctor referred by a sports agent, okay? And they said, so he had this pain here, okay? Upper hamstring area, right? Diagnosed with hamstring myofascial pain issue, okay? Right? So this, I said, how long have you had it? He said 3 months. 3-month hamstring strain, right? And I'm like, have you been playing on it? Like, how is this continuing to go on? Why is it not healing? He said, yeah, I've been playing on it, right? So, lay on your back for me a minute. So what I did is, so I had him lay on his back, right? And I went like this, and I said, does that hurt? Yeah, where does it hurt? Oh, it hurts in my upper hamstring. Okay, well, that would be indicative of a hamstring injury, right? So then I had him stand up, bend over. Does that hurt? Yeah, it does. Where does it hurt? Right there. Okay, indicative of a hamstring injury, okay? Then I had him lay on his belly, right? So go ahead and lay on your belly for me. I used to work in the NFL. These guys used to, tear their hamstrings, pull their hamstrings all the time. There's a knot in there if there's a hamstring issue. So I'm sitting there and I'm going like this, and I'm like, where is this knot? I don't feel a knot, So I'm like, that's interesting. So I'm like, but I'm never done assessing someone until I assess their pelvis. So I said, go ahead and stand up, buddy. So he stood up, right? And I said, go ahead and bend over for me, right? And I said, do you feel that? Where do you feel that? He said, in my hamstring, in his upper hamstring right here. So I asked him to extend back, and I made sure that he didn't have an upslip, okay, which he did not, because you can't gap an out flare. If you try to see if the person has an out flare while they have an upslip, and you don't pull on the leg first, then it's not a true accurate test. They'll still hurt, okay? So what I did is I had him extend back, okay? No upslip, both of my thumbs dropped, okay? So then I went like this, and I pushed like this. Pushed up here, like that, okay? I went like that, and I said, go ahead, bend. Is the hamstring pain still there? No, gone. Misdiagnosis. Thanks, Evan. Misdiagnosis. So this kid has had this for 3 months. It looked exactly like a high hamstring strain. It wasn't. It was an SI joint dysfunction because you feel your SI joint in your hamstring. Okay? So even if you're certain this is a sports injury, always clear the pelvis first. Always clear that SI. Okay? Go to wheltonmrt.com and go to publications. You click my SI protocol.